Porn addiction withdrawal symptoms. I'm Dr. Trish Leigh, cognitive neuroscientist and sex addiction recovery coach. Porn addiction withdrawal, it is real. And I'm going to tell you what the top symptoms are in this video. But I'm also here to tell you that you don't have to suffer with massive amount of porn addiction withdrawal, because if you implement the right strategies with the right support, as quickly and efficiently as possible when you decide you're going to quit porn, you can have that work together synergistically so that you don't struggle. And I've seen it lots of times with the people in my program. So if you need more support, please get it. You can get it from me, drtrishleigh.com. And if it feels good for you to get it from somebody else, go for it. Just get the tools and strategies that you need, because you don't have to suffer. Okay. Let's move on to what the withdrawal symptoms are. We know that the number one withdrawal symptom that people struggle with is anxiety and increased stress. Now, remember, if you're going into porn, you are doing it for stress reduction, and it's working very well, too well, unfortunately, because it's frying your brain. But it is, in fact, working well to stave off stress for you. So when you go into the screen and you get this massive dopamine deluge, it floods your brain and it chills your brain out, so much so that there's damage, but you definitely feel chill and numbed and you get what you want. So when you stop giving your brain that drug, it's an internalized drug addiction, basically. When you stop giving it that drug of choice, your anxiety and stress are going to go up. And the solution is to put more healthy mood regulation strategies in place. That's one aspect of it. But increased anxiety and stress. So if you stop watching porn and stop masturbating and you feel more stressed out, this is something that can happen to you. Also, number two is an increase in anger and irritability, that Dr. Jekyll and Mr. Hyde syndrome that I talk about. Because what happens is that you're swinging high and low. Your brain's going to try to cycle you through that porn addiction cycle that you've been through for so long, but it's not going to get what it wants. And when it doesn't get what it wants, the hijacker is going to get angry, and you're going to swing back and forth in between a couple different versions of yourself. The not so fantastic one, and then you'll feel better, and then you'll feel worse. So anger and irritability, agitation, kind of being off your game, and mood swings. Porn flashbacks. So you might experience porn flashbacks or euphoric recall of scenes. You might think about other people that you've been with, that you've done some of your favorite porn acts with. That is a call from your brain for mood regulation. It's saying to you, woohoo, I need some dopamine. Give me some dopamine. I'm used to all the dopamine you've been giving me for so long. I need some. I need it now. And that's why it's a withdrawal symptom, because it's withdrawal from not getting the dopamine that it wants. So when you give your brain dopamine in a different way, then you can offset those withdrawal symptoms. But those flashbacks, they're a call for dopamine. So if you experience them, just know it's part of the withdrawal symptom. Urges to watch, it's the same thing. When you have an urge or a craving, it's because your brain's telling you, I need dopamine. Let's go do this thing because I need some dopamine. But if you're going to leave it behind, you have to break the cycle. You have to pattern interrupt it, as I always say. So if you feel that, you know that your brain is unwiring, and then you can move on to rewiring it to the healthy sexual pattern and right off into the sunset. Okay, so many times when you get a handle on this thing in the day, guess where it shows up? In your subconscious. It will sneak into your sleep. Sleep disruptions are very common, but the beautiful thing is sleep's one of the first things that comes online once you move through this withdrawal period. So if you have disrupted sleep, it's a sign your brain is unwiring. And if you can push through, your brain's going to rewire. You're going to sleep better than you ever have. But in the meantime, you may also have sexual dreams. It's going to sneak into that subconscious in the night, and you may have porn dreams. So many people I work with, they'll tell me that they weren't even dreaming about sex. They were literally dreaming about watching porn. And that can, again, it's your brain trying to trick you into giving it the dopamine that it's been used to getting from watching sex for a really long time. So it may show up. Another thing that may show up for you is just low energy, lack of motivation. So we've talked about this before, that you go into the screen so that you get this dopamine deluge, and it's created a dopamine deficit in your life. No more dopamine deluge means you're still in a dopamine deficit until you rewire your brain to get dopamine from your work, from your relationships and from your hobbies. Get on purpose in your life. The more purposeful you get, the more you rewire your brain to get into the world for dopamine, not just dopamine, serotonin. Dopamine is the pleasure seeking neurochemical. So a way to offset low dopamine is to go do things that give you pleasure. But serotonin is the neurochemical of joy and happiness. So serotonin is a sunset. I love a beautiful sunset. In my house, we have beautiful sunrises out the back window and beautiful sunsets out the front. And I love all things celestial. We have really nice moon, being able to watch the moonrise and moonset too. I chose this house on purpose because those things give me a lot of joy. I can sit there and watch it. Joy and serotonin last a lot longer. They give you happiness. Dopamine gives you pleasure and it dies off quickly. So when you go into your world and you create purpose, you're giving your brain serotonin and oxytocin. Oxytocin is the neurochemical of connection. So you're connecting yourself to your real life and you're disconnecting yourself from the screen. And that takes a little bit of time, and withdrawal happens when you're doing it. But again, the more things you put in place, the 90-day program that I offer, it has all the pieces to unwire your brain, rewire your brain, and then hardwire in the new brain pattern. So if you're struggling with this, and especially if what happens is people stay in this withdrawal state for a little while and then they relapse because they can't take it. And then their brain, it's starting to unwire. That's why you get withdrawal. And then it's beginning to rewire if you start to do some of the things, the healthy things. But then you have a relapse and you know that unwiring might go backwards a little bit and that rewiring stops happening. And if you sit and you flip-flop in that state, it creates a lot of pain and anguish for you, and it makes it very difficult for you to move to the other side of it. So if you've sat in this withdrawal state, going back and forth with relapses for any amount of time, I'm here to tell you it does not have to be that way. One of the clients that I work with, super cute, he said to me, when am I going to hit flatline? Flatline's another withdrawal symptom. Flatline is you have no sexual desires and your libido goes down because these neurochemicals are all trying to recalibrate themselves, and you have low energy. So he asked me, when am I going to feel terrible? And I'm like, you're not, because you would have already felt terrible because we were working together for months. I'm like, you don't feel terrible because you're working this program. So when you work the aspects and the strategies and you use the tools and you have the support, you don't have to struggle with withdrawal. Okay, go over to drtrishleigh.com if you have any interest in that. If you are interested in helping me go upstream to help teenagers not get started or to come out of the screen as fast as possible, please consider donating at pornbrainprevention.org. The links are both probably popping up or they're below. And as always, control your brain or it'll control you.